Hey friends, today we're going to talk about weed, specifically as it relates to surgery and weight loss. I'm Dr. Barr, a bariatric surgeon in Dallas, Texas, and I constantly get asked about this, so let's break down the data. So, disclaimer, under no circumstances do I endorse any illegal activity, so if you live in a state where marijuana is still illegal, I'm not telling you to break the law in any way. Okay, now to the real stuff. I've previously talked about how smoking nicotine-containing products is a non-negotiable hard stop if you want to get bariatric surgery or surgery in general. It's because the data shows that nicotine puts you at an increased risk of complications during surgery and delays the healing process after surgery. So if you are partaking, be sure that you're not mixing or rolling with tobacco-containing products. Now let's separate out THC from CBD. They're both found in cannabis and have very different properties. CBD has been researched extensively and has positive effects on inflammation, anxiety, and chronic pain. It's even approved to treat certain types of epilepsy. THC is the psychoactive part. It stimulates your appetite and can reduce nausea. But is it safe for surgery? For casual users, THC has been shown in multiple studies to cause no difference in surgical site infections, bleeding, blood clots, readmission to the hospital, or ER visits. However, in a study from 2023, chronic or high volume users showed a higher rate of pneumonia, stroke, heart attack, and blood clots within the first 30 days after surgery. THC can also interact with your liver metabolism, some medications like SSRIs or blood pressure meds, so you for sure need to clear those with your doctor if you're going to have surgery. And following bariatric surgery, research shows that the mechanical and hormonal changes actually can lead to faster absorption and stronger psychoactive effects at even smaller doses. So it's really easy to get way too high, way too fast, which can definitely be unpleasant. And some people, it can actually worsen nausea and paranoia, and if you're healing from surgery and in some pain, the last thing you want to do is be paranoid and puking. And last but not least, it's important for your weight loss. Studies show that post-op use can lead to graze eating, loss of control eating, and nighttime eating compared to non-users, which can all derail your progress. Bonus question I always get is whether it matters if you smoke it or do edibles. And when it comes to weight loss, the answer is surprisingly yes. THC, when ingested, leads to higher cravings for calorie-dense foods than the baseline increase from smoking. Not to mention that edibles are usually loaded with sugar. So in short, the munchies are much worse, and it's already essentially candy. Remember, surgery is a tool, not magic, and the diet and exercise are key parts to your success. So anything that makes that harder is obviously going to slow you down. Remember, we listen and we don't judge. It's about safety and your goals. THC isn't automatically off the table, but it should never be resumed without your care team knowing. You're not alone, and we're here to guide you through every step of your journey. Remember to like and follow for all things bariatric surgery, and if you're looking for a surgeon in Dallas, Texas, you can see us at DFW Bariatric and General Surgery.